Coming to the personal journey, ma'am, can you share your journey in the medical field and what inspired you to transition from being a doctor to founding DYOTA4You?
Okay. So I'm Dr. Viritha.
Right.
So I belong to Hyderabad. I hail from Hyderabad. I did my MBBS from Bhaskar Medical College. So initially, this social thing, the impact, the preventive medicine thing was not on my mind. I was initially interested into clinicals only. But during our third year of our graduation, we have a subject called community medicine. So most of the people don't like that subject because it is very boring, or it is more like social sciences and all. But somehow I was so much interested into that subject because that was a different perspective to health. Unlike a patient going to the doctor and getting treated, that subject entirely focused on prevention. So that is why community medicine, from there, then I started picking up interest. So gradually I wanted to shift off to non-clinicals, especially to public health. And then later on, I worked as a duty doctor for a few years. And later on, in Indian Institute of Public Health, I've done my master's in public health. I graduated last year from IIPH.
Okay.
So post that also, I did not want to initially enter a job because job again, we will be confined to those specific roles. Whatever bigger vision we have, we cannot be able to do. I felt that. So then I wanted to start my own organization, and then I did it.
Great. Absolutely inspiring. So how has your experience as a doctor at various hospitals influenced your approach to public health and sustainable development?
Yes, sustainable development was always on my mind because I always believe that health is not just the physical or the mental aspect. There's a holistic concept, right? So there should be social health, there should be environmental health, there should be economical health. There are so many dimensions to health. So when we work in hospitals, we just look at the one dimension, which is the physical dimension, and sometimes it is a mental dimension of health.
Right.
But there are so many other aspects also. There should be financial health, a patient.
Yes.
We in public health, we believe in 3 A's. There are 3 A's actually: affordability, availability, and accessibility. So a patient should be able to afford treatments. A patient should be able to access them, and the regular treatment should be available. So that was the gap that I usually found in every hospital that I worked. These 3 gaps were the major gaps. So what I felt was, I'm not undermining clinical medicine, but that is covering just one dimension. But when we come to public health, we will address the core aspect, no? So in that way, I felt that we can improve societies, we can improve communities, and so that will lead to a larger impact.
Yes. That will create really a larger impact.
Yes,
so, ma'am, is that name Dyota? Is it correct? Am I spelling?
Dyota, actually. It is a Sanskrit name for light. Dyota.
Dyota means Doota, like angel, right?
No. Dyota means light.
Light. Okay. Dyota. So what motivated to start DYOTA4You, and what are the primary goals and objectives of the organization?
Again, coming to the same thing, I was a bigger picture person.
Yes.
This one-to-one interaction, sitting with a patient, treating them, that was never on my mind. So I always wanted to work with the community. I was also interested into civil service. I prepared for civil services also. So in that way also, my focus was never on a single person or a single patient. It was always at the community level. So if that is possible only if I have my own organization. I can plan my own things. I can plan whatever I want to do. So that is how this, initially I was very skeptical to start an organization, if I would be able to handle it or not, because I was very naive after public health, graduating from public health. But then, yes, I felt that everybody is like that, no, when they start, gradually we'll be learning things. So right now we are doing very good work. I'll be telling you about all those works that we'll be doing also. So yes. And about our organization specifically aims at communities, specifically aims at sustainable well-being.
Okay.
So for that sustainable well-being, we've actually created a cycle also called DYOTA Cycle. You imagine the community to be a small family. So if you want a family, if you want a child in a family to be well, you have to be providing him education, you have to be providing him health, In that way, as he grows up, he will be able to get an employment opportunity. And once he gets that employment, for him to sustain also, he should have good health again. So the same thing, whatever we apply to a family, if you apply it at a larger level to a community, that is what public health is all about, or that is what community well-being is all about. So we wanted to focus on providing health, we wanted to focus on providing education, also livelihoods. In that way, we are providing the necessary input for them to live a long, sustainable life. Sustainability is not about the well-being in the present situation. It is about a long-term well-being, right? Sustainability.
Yes.
So if you want to provide long-term well-being, these are the aspects. We have to focus on health, education, and livelihood. And we also wanted to include a little bit of environmental aspect in our organization thing. So that is why we also want to focus on greener initiatives. That could be solarization, or it could be sustainable farming.
Yes.
So that is also on our mind, but these are the primary ones. Health, education, and livelihoods are our primary focus.
Superb. So how do you measure, one second, what are some of the biggest challenges you have faced in the implementing sustainable development projects, and how have you overcome them?
In these sustainable development projects, the major thing is awareness itself. Most of the people are not aware. Now, Anganwadis are being trained by the government, but if you look at the knowledge they have right now, it is not up to the mark. So that is the primary thing. There is less knowledge, there is less awareness at the worker level or at the individual level. Most of the mothers, especially in rural areas or secluded areas, they don't have that much awareness. So awareness is one thing. To generate awareness is itself a big task for us, because people are not ready to accept things, people are not ready to hear. So that is itself a big thing for us. Now, once we generate awareness, again, we making sure that the project is sustained, making sure that we take feedback from them, they come again for feedback. All that is also very hard for us. And research also we want to focus, because that is also an area that lacks a lot. There's no proper research in whatever things are there, whatever data is available. So that is also one the negative thing that I saw in throughout our.
So you people, when you take up the project, will you be able to train them, Anganwadi teachers? Otherwise,
we've actually collaborated with another organization, because this project runs in Jharkhand.
Yes.
So we've collaborated with another local organization over there for the implementation. So right now we are acting as content developers and technological partners, and also a part of the implementation we are doing. And implementation, the collaboration is happening.
Great.
It is a bigger
nice. That's really nice.
Right.
That's really nice. So coming to the next question, how did the impact was created of your initiatives in community of well-being sustainability?
Yes, ours being we've started a year back. So for our organization right now, we are mostly focusing on health related initiatives. We are not yet into education. They are on the line. We are just working on it. But education, livelihoods are still on the line. We are just making strategies for them. Right now, we are working in the health sector. So with respect to health, we focused on childhood. As I told you, Anganwadi project, it is working on children, especially these are proper tribal blocks in Jharkhand. So we are focusing on those areas which require service ultimately. And then menstrual hygiene, as I told you, we are focusing on the adolescent age group, which is again a target group for most of the things. So that project is also like that. And one more project is on the line that we are talking with the Jharkhand government. Talks are happening. So after that, I think I'll be able to let you know.
So how did your education at Indian Institute of Public Health shape your vision for DYOTA4You and its initiatives?
Our college was a premier organization. Our institution was a premier organization. So we had excellent faculty over there, people with a lot of experience, lot of expertise. We had professors who have been in the field of public health since around 40 years. So working under them with their mentorship, we had a lot of field exposure. So when we went on the field, as long as we were studying in books, no, it is just a theory thing. So once we field exposure, once we went to the field, and once we have seen where exactly this public health needs to be concentrated, then that helped me a lot in understanding about what our organization should work at. So in case I didn't have field exposure, I would have never known those gaps, right?
Even the
So-
textbook doesn't show that gaps. I think even
Exactly.
only the practical things makes us to know aware.
Yes,
about
and
it.
even if they mention, whatever is presented and whatever is in reality, there's a lot of difference again.
Yes, obviously.
So only when I go to the field, only when I see things in real, I'd be able to understand the gaps. So wherever gaps are there, I made sure that those things are included in our organization's agenda and strategies.
Oh, that's nice, ma'am. Even you have seen the reality and you just come up with such an ideas. Isn't it?
Yes.
Nice. That's nice.
Yes.
So, what role does education play in achieving sustainable communities, and how does DYOTA4You integrate education programs into its projects?
As I told you, that is the primary thing that I have seen. Awareness on various aspects of health is at the lowest. That was a primary thing. So even if I go and educate someone, if they're not ready to take it, if they don't understand how important it is, I won't be able to handle it, right? So that was the primary thing that I observed. So whatever project we are undertaking, there is always a component of education and awareness. Without that, it is impossible to sustain. Now, because we are aiming at sustainability does not happen without understanding how important things are. So only if they understand, if they're made aware of what menstrual hygiene can do to your body, what menstrual hygiene can do to the society, what menstrual discipline, whatever men have to support to women, all these things play a key role in their lives, right? So if they're not aware of all, if you're not making them aware of these things and just training them, it does not make sense. So education and awareness is the primary thing. Whatever, be it education, be it livelihoods, education and awareness is the first step. Only then you go into the actual project and implementation.
Yeah. So, coming to your personal insights, how did you balance your professional responsibilities with your personal life, and what keeps you motivated and inspired?
Motivation and inspiration, I always feel that should come from inside. Outside motivation we take, it stays for a day or a two or maximum a year. But
Until we forgot that line, right?
it has to come from the inside. So until you have that zeal, that strong zeal to create a change or to create an impact, that motivation won't come to work continuously, right? And with respect to my organization, definitely family support. My father, he plays a key role in instilling these thoughts in me, that just doing something for yourself and then that is not the purpose of life. There's a lot of things that you have to do. So in that, my father created that zeal inside me. And now with respect to my, definitely family support should be there. My husband, and always he supports me. So in that way, I'm able to balance, definitely.
That's really nice, ma'am. Even the same zeal you're surrounded with such a zeal persons. That's really
Yes.
nice to have such a successful person
Family support
on
still we
our
would
panel.
be able to do without family support, but it would be hard. It would be tougher.
Truly said. Because any
Yes.
places you need to go, then it will be a great problem, right?
Yes,
If they support you, wherever you can go, whatever time you can go and come, that doesn't matter.
We can focus on our work. Right?
Yes, exactly. That's what.
That's really nice, ma'am. Thank you so much. Actually, we end up with the questions. Really, very happy to have you on our panel and letting us know your journey and your initiatives and your experiences and your challenges you have faced. Really, thank you so much for sharing us. And we will surely get back to you with 1 minute teaser. Okay, through mail. I think the person who have been contacted you, she will share you. And other one is the full edited and sliced video will be shared to you after your confirmation only. We will stream on the social media. Okay.
Okay.
Thank you so much. It was really a pleasure having you on our team.
It was the same over here also. I was looking forward to this meet. It was wonderful talking to you.
So, and all the best for your DYOTA.
As soon as we get the teaser, we'll just provide you. And also for the collaboration part, we're going to send you the mails, ma'am.
Sure.
So that we get contacted, right?
Definitely.
If any other issues you want to talk, we can provide a call with our CEO and our operation manager and everyone, ma'am. No issues.
Okay, fine.
Right.
Thank
Thank
you,
you
ma'am.
so much, ma'am. Have a great day.
It was
Thanks for
great
taking
talking to
the
you
time.
guys. Thank you.